Good morning. Welcome back to Unspoken Exit, a series about suicide, suffering, and saying. So let's talk about depression, one of the most common and most misunderstood roots of suicide. Depression. You may be surprised to learn that not all people with depression are suicidal, and not all people who die by suicide are visibly depressed. But when depression does lead to suicidal ideations, it often follows a painful and invisible path, one that can feel endless. What depression really feels like? Most of us have heard, just get over it. It's not that bad. Most of us have been taught that depression is just feeling sad. Depression isn't just sadness. It's a shut down. It's a loss of motivation, a deep fatigue, a grayness that seeps into everything. People with depression often describe feeling numb, disconnected, or like a burden to others. They may believe that the world would be better off without them. Not because they want to die, but because they think their presence causes harm. Imagine carrying that belief for months, for years, for decades. Imagine asking for help and being dismissed. Imagine people asking you what's wrong and you not having the words to describe it. Imagine this. Imagine waking up and everything that once gave you a sense of pleasure, peace, calm, no matter what you did, this emptiness, this numbness grows and can't even be escaped. Sex, food, drugs, alcohol, everything, video games, social media, everything that gives us a feeling, desire, drive, just is no longer there. It does nothing for us. And imagine slowly going and struggling throughout your day. And the response that you get from others who keep asking you what's wrong, are you okay, is, oh, it's gonna be all right. Just hang in there. Things will get better. And deep down, this voice, this belief, this core part of you is just needing something else, and you have no idea what it needs. Depression can be a liar. It tells you you're unlovable, that things will never get better. Your past defines your future, that help doesn't work. These are called cognitive distortions, patterns of thinking that aren't true but feel true when your brain is clouded with depression. Hell, parts of this might actually be based in truth. When we've reached out over and over, And the help that we get doesn't do anything, or nobody knows how to help, that actually might reinforce some of these beliefs. When someone is suicidal due to depression, it often stems from the belief that no relief is possible, that they've tried everything, that their existence is more painful than their absence would be. One of the most dangerous forms of depression is the one that you can't see. Some people function, they smile, they go to work, they post selfies. They say, I'm fine, I'm great. And then one day they're gone. This is why checking in with people, really checking in, is so important. Not everyone who is struggling will look like they're struggling. Depression feeds on shame. The shame of not being strong enough. The shame of needing help. The shame of struggling when others have it worse, or everyone else has it together. Shame makes people isolate. And isolation makes suicidal thoughts grow louder. When we can reduce the shame, we can reduce the risk. So I'm going to try not to go on a tangent, especially for folks who know how I feel about this particular issue. So depression needs treatment. Often multifaceted treatment, therapy. And this can be cognitive behavioral therapy, EMDR, psychodynamic work, in the way that these therapies are structured. Not someone claiming they're doing CBT, EMDR, psychodynamic, DBT, and it's not. What they're doing is not, or does not even come close to these particular therapies. I'm gonna leave it there. Another option, another treatment option is medication. So I'm not a psychiatrist, I'm not a psychiatric nurse practitioner, I'm not someone who can prescribe medications. But the research behind depression says that SSRIs, mood stabilizers, and some other types of medication can be helpful. My recommendation is always to not talk to your primary care physician about medication, but talk to somebody who specializes in medication, a psychiatric nurse practitioner or a psychiatrist. And I'm going to leave it there. Another arm of treatment is community support, peer support. Support groups, meaningful relationships that folks show up the way that they say they're going to show up, are able to meet your needs, are able to show up ready, willing, and able for you. And I'm going to leave it there. Most important, structure. The therapies that work the best for depression are the ones that are super fucking structured. The community support that oftentimes works best is when it's structured. And when I say structured, I mean there's a routine, there's a purpose, there's small goals. Peer support groups, same thing. Those meaningful relationships, same thing. When there's structure, when there's routine, when there's purpose, when there's goals, when there is something, there are boundaries surrounding it, oftentimes those work the best when navigating depression. But more than anything, people need to feel seen, heard, and held in their own humanity. If someone you know is depressed, Don't try to fix them. There's nothing broken. They're not bad, they're not broken, they're not malfunctioning. Just stay. Listen. Invite them back into connection. You're not seeking solutions. You're not figuring out the problem. You're definitely not figuring out why. Listen. Stay. Just be with that person and invite them into connection. So, suicide is rooted in depression. Suicide that is rooted in depression is not about weakness. It's about the exhaustion that comes from carrying this invisible weight far too long. In the next episode, we'll move from depression into something more abstract, but just as powerful: the existential void. So thank you all for being here, and I look forward to seeing you in the next episode. I hope you all have a wonderful, amazing rest of this beautiful day, and I'll see you soon.